Did you know that if you and your loved one have complex health needs, you can request a Continuing Healthcare (CHC) assessment through the NHS? This assessment determines whether someone qualifies for NHS Continuing Healthcare funding, which is a fully funded care package provided by the NHS to cover health and care needs. To begin the process, you or a family member, carer, or advocate should speak to a GP, nurse, social worker, or other healthcare professional who is involved in your care. They can help you request an initial assessment to determine whether a full CHC assessment is necessary. You can also contact your local Integrated Care Board, ICB, directly to request a CHC assessment. If you're in a hospital or care setting, staff should consider whether a CHC assessment is appropriate before discharge. The first step of the process is a screening stage called the checklist assessment. This is a brief assessment carried out by a trained professional, such as a nurse, social worker, to determine whether you should proceed to a full CHC assessment. If the checklist assessment is positive, you will undergo a full multidisciplinary assessment. Once the full assessment is complete, the local Integrated Care Board, ICB, will review the findings and decide whether you qualify for NHS Continuing Healthcare funding. If you are not eligible, the ICB should provide reasons for their decision. You may still qualify for NHS-funded nursing care, FNC, if you are in a registered nursing home. Also, if a person's condition changes, a reassessment can be requested. If you are not satisfied with the outcome of your CHC assessment, you have the right to appeal. You can start by requesting a detailed explanation of the decision and discussing your concerns with the ICB Integrated Care Board that conducted the assessment. If the issue is not resolved, you can request a formal review through a local resolution meeting. Should you remain dissatisfied, you can escalate the matter to an independent review panel. As a final step, if you still disagree with the decision, you have the option to take your case to the Parliamentary and Health Service Ombudsman for further review.